Now let's discuss what could happen if we use a wrong sized cuff. If we use a too much narrow cuff, it can overestimate the blood pressure reading, and if we use a too much wide cuff, it can underestimate the blood pressure reading. Now, how can we correct this? A practical and quicker way to quickly and properly estimate a properly sized blood pressure cuff is to pick a cuff that covers about 2/3 of the distance between the patient's elbow and his shoulder. Also, we have to carry about 3 cuffs in different sizes. First is the large adult size cuff, which is used for bariatric patients, that are the obese patients. Second is the regular adult sized cuff, which will cover almost any type of adult other than the obese patients. Third is the pediatric cuff, and we will need multiple sizes in them as it covers the patient from birth till age 16 to 18.